For our update today, we have an additional 55 test positive cases here in British Columbia, bringing our total up to 1,121 people who have tested positive for COVID-19 here. That includes 525 people in Vancouver Coastal Health, 386 in Fraser Health, 72 on Vancouver Island, 121 in the Interior Health Region, and 17 now in the Northern Health Region. In addition, we have an additional community outbreak related to an inmate at the Okanagan Correctional Centre in the Interior Health Region, and this is, of course, something that we have been concerned about and planning for. There was a number of measures put in place to try and reduce the risk of introduction of COVID-19 into all of our correctional facilities, both the provincial ones and the federal correctional facilities across the country. There has been an active surveillance program, and this is the first test that has been positive in a facility here in British Columbia. As people are probably aware, the Provincial Health Services Authority has taken over the health services for our correctional facilities across British Columbia a number of years ago, 2 or 3 years ago. So PHSA Correctional Health and Interior Health have been actively managing this outbreak since we were notified yesterday evening. In addition, we continue to have the 21 long-term care or assisted living facility outbreaks that are actively being managed both in Fraser Health and in Vancouver Coastal Health. Currently, we have 149 people hospitalized with COVID-19 in British Columbia, and of those, 68 are in the ICU or critical care areas at this time. Sadly, we have had an additional 6 deaths over the past 24 hours in British Columbia, bringing the total number of people who have died to 31 here. That includes 3 additional deaths in Vancouver Coastal Health related to 2 of the long-term care facility outbreaks, 1 in Fraser Health, and for the first time we've had 2 people who have died here on Vancouver Island. Both of them here on Vancouver Island. So we obviously put out our condolences again to the families, the care providers, and the communities who will be missing these additional people. We have now, on a positive note, 641 people who have fully recovered and are now out of isolation from COVID-19. So this has been, as I've said every day this week, it's a challenging time for us. It's a challenging time across the province. We're in that phase where we need to be incredibly careful about what we're doing. We need to continue to take these actions that we've asked you to take and we've directed you to take over the last 3 weeks. We now have more than 1 million cases of this disease worldwide. We know that there's a dramatic ongoing outbreak in the United States, and across Canada we're seeing increased numbers of cases, particularly in our communities in Toronto, in Ontario and Quebec. We have now over 1,100 cases here in BC, and it is growing. The number of people who are hospitalized is also growing. Although, thankfully, by a small amount. And that, I truly believe, is part of the reason that we are seeing the growth in a manageable way here in BC is because of what everybody is doing together. And that it remains the important thing around physical distancing that we can all do, and allowing our public health services and our healthcare workers to focus on the people in our long-term care homes, to focus on our hospital settings, to ensure that we can identify and rapidly respond to outbreaks in our communities, to try and stop those transmission chains. Part of this, of course, is making sure, without exception, that people who have come into BC from around the world are immediately complying with the orders, the federal quarantine orders and our provincial orders to self-isolate, to quarantine for 14 days. One of the things that we do know is that there will be some people from British Columbia who will be flown home from one of the additional cruise ships, the Zamdam, that's apparently going to be docking very soon in Florida. And we've been in contact with our counterparts at the federal government to ensure that they are appropriately assessed when they come back and that they are actively managed in quarantine. We know that these are such a high-risk setting and that we have had people returning to British Columbia from other cruises who have developed COVID-19. And we need to be very careful to support these people so that they are able to effectively isolate and that we have no transmission should anybody become ill. I also want to talk a little bit about some of the things that we've been asking people to do and requiring people to do in British Columbia around non-essential travel. And there are many of our smaller communities that are very concerned about people coming to vacation homes, to fishing lodges, etc. And I am asking people now to forego those types of travel. All non-essential travel, particularly to smaller communities where we might not have the resources to support you should you become ill or should there be transmission in those communities. And that's a really important thing that we need to do now to protect those who are more vulnerable in those communities, particularly our seniors and our elders in our small and remote communities around the province. In addition, we know that there's a very important time coming up for many people of different faiths. We have a number of religious celebrations coming up in the next 2 weeks, including Easter, Passover, Ramadan. So there are many faith-based celebrations that are happening, and I want people now to start thinking about what we can do to support people in practicing their faith without having to have in-person gatherings. And I know many of the faith communities have been doing this already and have been particularly supporting elders and seniors in their community to make sure that they can safely participate virtually, in many cases, in these important religious ceremonies. And there is no more important time than when a community is in crisis, as we are in BC, to make sure that we can do these types of important ceremonies in a safe way. So we need to use the many tools that we have available now to connect with followers in other ways than in person. And we'll be talking again with our faith leaders next week to make sure that we can all do this and share ideas about how to support each other in a safe way. We are getting through this, and we will, of course, get through this together. And I am, again, very heartened by the fact that across this province, people are taking the important actions that we are asking them to take, and doing that in support of each other, in physical distancing, and we are standing united in that in a virtual way. We're working together to keep that firewall strong, to make sure that we can prevent the transmission of this disease as much as possible. We need to continue to follow these orders and precautions that we have in place. We must do all we can to protect our families and our communities across British Columbia.